Hello there. Welcome to my show, COVID-19 update by Heerak for December 5th, 2020. Yeah, as you know, I'm Heerak Christian Kim, independent candidate for U.S. Congress in Virginia's 8th District. That includes Arlington, Alexandria, Falls Church, and parts of Fairfax County. Um, it's interesting, huh? Today is a ninja day. They actually have a ninja day. Can you believe it? I have to confess, I grew up watching ninja movies, loved it. Teenage Mutant Ninjas were really popular when I was growing up. Um, yeah, I don't know if you have seen Teenage Mutant Ninjas, but it's pretty entertaining. Um, Michelangelo, Leonardo, they love pizza. It's just like Generation X. Oh, it's funny. Um, but what's not funny is how many Americans are dying every day in the United States of America. That's not funny at all. In the last 24 hours, 2,529 people have died. Um, That's the new normal. Over 2,500 people dying every day. You know, I remember going to Alamo in Texas. I mean, as you can see from the photo, um, I visited Alamo, and there was a nice church, in the San Antonio area. Ooh, excuse me, I'm a little bit tired because I had a 12-hour shift at the hospital. Yeah, as you know, I'm a nurse, registered nurse at Virginia Hospital Center. And I worked 12 hours today taking care of a lot of patients. And yeah, I mean, I'm a really good nurse. So those of you that taken care of by me, know that. Yeah, if you come to Virginia Hospital Center, you may be taken care of by me. But anyway, yeah. Um, San Antonio, this church in San Antonio is definitely worth visiting. If you live in San Antonio area, maybe you've been there. If you haven't, it's definitely worth a visit. If the church is open for a worship service tomorrow, you should go just to check it out. It's a beautiful church. Um, Obviously, you do risk COVID-19 infection if you go to that San Antonio church. But well, you see how pretty that is. It looks better in real life. Um, because we have 2,529 COVID-19 deaths in 24 hours, we have 281,134 deaths. And confirmed cases is 14,575,623. Um, yeah, I mean, it seems foolish to open schools. You know, um, it's probably because the schools were open that America has so many COVID-19 cases. Oh, excuse me. Oh my gosh. Um, yeah. Yeah. Things are going to get bad. With lot of people getting infected. Um, can you imagine when the ICUs are completely full in Virginia? Or I'm in Arlington, Virginia. Can you imagine it when the ICUs are completely full? You have like people dying just left and right um, outside the hospital. Um, up to 100% of the people can die when ICU bed is full. And let's say there are like 1,000 people who need an ICU bed, they could all die. Um, how about if the number is larger, like 2,529? If all the ICU beds are completely packed, all 2,529 people will die. How about 10,000 people? What if 10,000 people need ICU beds? Well, if ICU beds are full, then all 10,000 can die. Probably will die. Most likely will die. You know, there's like 90% chance that you will die. They don't have ICU beds. I think that's the way to look at it. We have a lot of many months to go. We're in December. We're December, January, February, March, April, May, June. So it's like 7 months to go. If ICU bed is full in December, you can have 100% of the people die in December, January, February, March, April, May, June. 100% can die. Obviously, death rate is only at 2% now. But if you have 100% of the people dying, eventually, you have 20% of all cases ending up in death. So let's say in a given week, we have like over 200,000 cases today in 24 hours. In a given week, 5-day period, you have 1 million cases. If the ICU is completely full in all the hospitals in America, 1 million of them who got COVID in flu season, let's say, becomes serious, and let's say 700,000 of them are, or let's say 500,000 of them really need hospital, all 500,000 people can die. Uh, that's just in 1 week. Um, so in 4 weeks, you have like what? 2 million people die. Yeah, I mean, you got to remember 100% of the people can die if there are no ICU beds. If there are not enough nurses to take care of you, you know, up to 100% of the people who need the care can die. Um, yeah, so it's really sad. Um, you got to put things into perspective. Really, what's the most important thing? There is a real possibility that the United States as a nation can collapse by next year. Um, that's a possibility from a social scientific perspective. Let's see what happens. Um, how would the country look if the country has 30 million people dead by June? That's because if the deaths are increasing exponentially and all the ICU beds are full and 100% of the people die, and you can see like 200,000 people are infected um, in one day because the schools are open, right? I mean, schools, your kids take school bus to school. They're inside that bus. I mean, how socially distant do you think you are inside that bus? Do you envision your children washing their hands during 1 hour bus ride or 30-minute bus ride? I mean, of course they're going to get infected. It makes just look at that. I mean, it makes a lot of sense. If schools are open, you're just asking for it. How are you going to social distance inside a school bus? How are you going to social distance? Who's going to monitor? What, the bus driver is going to monitor every school child who boards the bus to make sure they're socially distancing? I mean, isn't that too much to ask of a bus driver? So what are you going to do? Like put an extra person there in the school bus or extra couple people there to make sure the children social distance? Well, what are you going to do? Have 5 people riding in the bus at a given time? When a bus normally carries, what, 30, 40 people? You guys just socially distance and put 5 per bus? Do you see why opening public schools with school buses is just asking for COVID-19 to spread? I mean, just simple logic here and common sense. I mean, you cannot social distance inside that bus. I mean, show me how you're going to social distance inside that bus. Show me. How many kids can go on that bus socially distancing to meet CDC guidelines? Show me. Dr. Fauci, show me. Dr. Redfield, show me. Dr. Goldman, show me. Dr. Gupta, Sanjay Gupta, show me. Bill Gates, show me. How is that possible? And are you surprised that we have so many COVID-19 cases in America? When you stuff your children inside that bus, what? All you talk about is the classroom. You know, how many classrooms do you think meets the basic CDC guidelines for social distancing? Even if you're saying that it's not airborne, I mean, how many of them do you think meet the basic social distancing guidelines of CDC? And so are you surprised that America has so many COVID-19 cases when schools open? Think about it. Of course, you're going to have proliferation of COVID-19. Um, yeah, it's a serious problem when you're opening schools in the middle of a global pandemic. You're just asking for death, COVID-19 death. You gotta shut the schools down. Um, I mean, that's if you want to survive, right? Um, let's look at Middle East. They don't have those yellow school buses, right? You know, it's an American thing, right? School buses. They don't have school buses in other countries, right? Um, Iran has the most number of cases and death, and so they have 1,028,986 cases, 50,016 deaths, 5% rate. Iraq is number 2 in the Middle East with 562,520 cases, 12,411 deaths. They're number 2. Number 3 is Saudi Arabia with 358,526. Death is at 5,954. That's like 2 days in America, right? At this rate that we have today. Israel, I mean, you will not see a school bus in Israel. So you're not stuffing children inside that little sardine compartment of a yellow school bus to go to school. Israel has 3,826 cases, 2,909 deaths. It's almost less than America. It's about comparable, right? How about Jordan, number 5 in the whole continent of Middle East? 237,513, 3,010 people have died. Folks, it's really bad in America. There's no question about it. When you open schools, you're operating school buses. How many people have you heard talk about the buses in COVID-19? School buses. Obviously, you're not going to get to school walking, right? Most students. So school bus is a factor that you have to compute in. California COVID hell starts. California is one of these states where schools opened, many schools opened, and you see what's going on in California. COVID-19 hell has descended upon California. So many people can die in California, it's not even funny. I'm predicting that minimum 1 million people will die in California from COVID-19. When ICU beds are gone, you can have 100% of the people die. Don't forget that. First article. Let's see what it says. COVID-19 is greatest threat to life in Los Angeles that we have ever faced. Garcetti says, that's the mayor. That's by Luke Money, Sean Green, Rong Gang Lin Tu, the second, in Los Angeles Times. Let's read the article. Another alarming spike in COVID-19 cases Friday in Los Angeles County prompted officials to sound new alarms about the need to stay home to slow the spread. This is the greatest threat to life in Los Angeles that we have ever faced, Mayor Eric Garcetti said Friday evening. So that was like yesterday evening. The simple truth is that we know that COVID-19 rapidly spreads as a result of our own behavior, like riding in a school bus. You know, I mean, geez, I mean, why would you want to open up schools? I mean, there are children involved. Um, Children's lives are in danger. Uh, the county has broken single-day new coronavirus record on 3 of the last 4 days. Oh my gosh. Can you believe that? Second article. California's latest stay-at-home order to take effect in San Diego County on Sunday. So stay-at-home order in California for like many Californians, millions of Californians starts tomorrow, Sunday. Mark Saunders, 10 News. A significant quote from that is, California's regional stay-at-home orders will go into effect in San Diego County on Sunday. This is like city of San Diego and its surroundings, greater San Diego. San Diego County on Sunday after the Southern California region fell below the 15% ICU. You see how quickly they're filling up? Original prediction was like many days into the future, but I mean, it's like warp speed infection, So California, Southern California region fell below 15% ICU threshold that triggered the restrictions, which means Southern California districts is in danger. The State Department of Public Health announced the Southern California region, which includes San Diego, Los Angeles, Orange, Riverside, Imperial, Inyo, Mano, San Bernardino, San Luis Obispo, Santa Barbara, Ventura counties. Oh, Ventura counties. Is that where Emily lives? Emily Norris? Oh, hi, Emily. She's one of our CNA clinical nurse leader cohort members. As you know, I graduated from Georgetown University on August 24, 2020, with 24 other clinical nurse leaders. And, there are several of us who lived in California. I lived in California for a while when I was trained as a professional historian at UCLA. So I know California very well. But there are people who have their permanent home in California. And Emily Norris is one of these permanent residents. She's a nice person, and I guess she married her childhood sweetheart. Because I got a text today from Betsy, Betsy Bel, what's her last name? Belfantiori? I can't remember the full last name. Oh gosh. Um, let's see. Um, yeah, she tweeted. Not she didn't tweet it out. She group message to all of us clinical nurse leaders, congratulating Emily Norris as Emily Norris McCarthy. Because she was due to marry, and engagement marriage was announced a long time ago, like over a year ago. So we're kind of like all hoping, her wedding would go well. And I guess the wedding was today, Saturday. I don't know what. I guess she missed the what do you call it? The stay-at-home order by one day. So if she's getting married today, she's just made it day before. Um, because I think she is in Southern California region. Oh, I feel so sad for Emily. Get married once, ideally. Uh, for this to happen, I mean, it's tragic. I mean, probably Emily thought that by December 2020, COVID would have been gone, right? You probably think like COVID will be gone by next year, like next year December. But we'll be here talking to each other, saying, "Oh, remember like a year ago when you thought COVID-19 would be gone?" Yeah, that's the conversation we'll probably have. Um, and the sad thing is, by year 2021, a lot of people would have died. In America, I'm estimating 30 million by June. So obviously by December, you may have like far more than that. Um, can you imagine if you plan for a wedding and it gets canceled and canceled because of COVID? I mean, you should just get married because there's high chance that this thing's going to last for like 10, 20, 30, maybe not 10, 20, 30 years, but maybe like forever. You don't know. HIV virus seems to be forever. Hepatitis C virus seems to be forever. So it's a big concern for many Americans. Um, so in Southern California, in these counties, ICU capacity fell to 13.1, meaning 87% of all ICU beds are full. And that was on Friday, but the number dropped to 12.5% on Saturday. Look at this. Every day, at this rate, they're not going to have any more ICU beds left next week. And that 100% of the people may die. If they need an ICU bed, it's almost 100% guaranteed they will die. Um, but even mild cases of COVID could end up with you requiring ICU bed, because you could have a common cold and that could progressively get worse into like pneumonia or bronchitis, and then you could die. Um, Same with COVID, it may start out with like asymptomatic mild COVID, but somehow, it becomes a little bit stronger. You start coughing and you start sneezing. You have flu-like symptoms, and before you know it, you're dying. Um, and you need an ICU bed. So asymptomatic people can become symptomatic and even eventually become severe in the flu season. So it's a serious problem we got to think about. Um, the restrictions will begin for a region at 11:59 p.m. That's tomorrow. Yeah. Los Angeles, San Diego are shutting down. Yeah, yeah. You see how serious it is because if they don't shut down, so many people are going to die. Um, Number three, five Bay Area counties enact stay-at-home order starting Sunday, not waiting for state's timeline. So Los Angeles County, like southern, San Diego County, the southern region, they are going into shutdown because it's required by state law. Um, but Bay Area counties like San Francisco, San Jose, they're not waiting for the triggering system. They're just going to shut down. Um, so let's read that article. Number third article. Five Bay Area counties have decided not to wait for the state's planned regional stay-at-home order and are implementing the new restriction ahead of schedule. Alameda, Contra Costa, Marin, Santa Clara. That's where I think it's in Santa Clara, where Stanford University is. San Francisco and the city of Berkeley, where University of California, Berkeley is, which has its own public health department, announced the new measures in a joint press conference Friday afternoon. If they were to wait for the state's order, which is triggered when a region has only 15% ICU capacity remaining, it would be too late. As I said, if ICU beds are completely full 100%, then everyone after that who have COVID, who need ICU, will die. It's like 90, more than 90% guaranteed. If you're one of those individuals needing ICU beds and there's no ICU beds, it's over 90% guaranteed you're going to die. How are you going to live? How are you going to live? Um, yeah, it is very, very bad, folks. And it's only the fifth day of December. Um, can you imagine how much worse it's going to get? It's only fifth day of December. Um, yeah, as I said, I predict that there will be anywhere from 3 million to 30 million Americans dead by June. And more and more, you can see that I'm going to be correct, right? Um, I mean, when you open up schools in the time of global pandemic, that just doesn't make sense. You can't social distance inside a bus. There's only bus driver who's driving has to keep his eyes on the road. I mean, have you ever gone on a field trip with a bus full of kids? Um, if you're a teacher, you have. I'm a teacher, so I have. Um, or if you have a church youth group, maybe you could get an inkling of what that is. But church youth group riding a van is probably fairly smooth and safe. Um, yeah, it's school buses opening school. That's the reason why everything is really horrifically high in the United States. It's sad because we didn't have to open up schools, but we did. Both the Republican Party and the Democratic Party wanted schools open, and that's the problem, right? So you need the voice of dissent, Heerak Christian Kim, to come in and say things that are relevant and important for that specific time. Um, yeah, what can you say? California, COVID hell starts. And you can see why. And they're going to have to shut down for like 6 months. Um, and people who are already infected are going to get worse and worse, and they're going to die. Yeah, I'm predicting more than 1 million will die. Um, yeah, obviously, I don't want any of them to die, but what can you do? This is a global pandemic. I will give you more important data tomorrow that will help you put things into perspective. What's going on in America? What are the standards? What are the efficient ways to do X, Y, and Z? Um, yeah, so just keep your eyes open and watch tomorrow's show. I'm sure today's show helped many of you. I think we'll think about many issues. Um, yeah, it's yeah, I created this show on April 2nd, 2020 to help you and your children survive COVID. So this show's tradition continues with this episode as well. Um, if you are in a school district where they are having school buses operate, you have to tell them to stop operations and just go remote. Um, yeah, I mean, obviously, if you're the parent, it's your obligation. Yeah. It's like a lullaby. It's like putting you to sleep. You know what I'm saying? After 12 hours of shift, Um, as a registered nurse, uh, you know, um, helping people, and it's I mean, I enjoy it. I love helping people, and but it is not easy work. You know what I mean? It's I mean, obviously when you're trying to save people's lives, right? Because if you have a good nurse, people who could have died don't die. It's just that's why good nurses are important. That's why you're hoping like nurses won't burn out. Uh, and in New York City in April, a lot of nurses burned out. Once nurses burn out, the death rate skyrockets. That's a problem. Because nurses are not robots; they're human beings. So yeah, we're basically going to where we have never been as a country. Because now we have internet, technology, um, and that everything's going to be kind of like stress stress tested. Um, yeah. Um, California shut down basically regions, but it's not going to be the last state to shut down. Um, stay at home order is probably coming to California. I mean to Virginia as well. Just a matter of time. Um, because ICU beds are going to be completely filled in Virginia in the next several days or several weeks. Um, so that's coming for sure. It's coming to every state in America. Um, yeah, try to be smart. As you know, my official recommendation is you should socialize only with people who live under your roof. And try not to go outside too much. Create like an entertainment sports center inside your home where your children can kind of exercise, have fun. Um, but you gotta kind of protect. Yeah, you gotta protect. what you need, right? Um, yeah, but anyway, I'm glad. I think I'm falling asleep. So, let me just blow my nose. Excusez-moi. But but this show is important. I want to make sure that you get the information that you need. Um, a lot of things are happening. California is shutting down. Stay at home order, and you can expect Virginia to shut down completely. Like there will be another stay at home order. It's going to last like 6 months. I told you about this in the summer, right? I said go to the beach with your children, have fun, because in the winter, 6 months of COVID-19 hell, everything shuts down. You have to lock yourself in your home. Remember, I said that that's starting now. I mean, kind of started, but because you had like New York City of New York issue like stay at home order, curfew they call it. Um, Obviously, it's going to get stricter and stricter. So yeah. So but anyway, I will leave you there because yeah, after 12-hour shift at a hospital, working hard as a registered nurse, helping patients and everything. Yeah, you know, I'm kind of pooped. I mean, not pooped. I'm a little bit beat. You know, so I mean, it's important for me to bring you this helpful information that can save your life and your children's life, but I need my sleep. So I'm gonna bid you adieu, and I'll bring you some more information tomorrow. Hopefully today's show helped you and will help you, right? Because we are headed for 6 months of national shutdown. I mean, the whole world is basically. Um, yeah, so it's going to be bad in the next coming 6 months. But yeah, but I'll try to hold your hand through it all. You know what I'm saying? Yeah, just check back tomorrow. I have more important detail for you and analysis and helpful guidance that can help you and your children survive COVID. So I guess I'll bid you adieu and see you tomorrow. Bye.